Insurance Coding Part 2. HCPCS, Healthcare Common Procedural Coding System, generated by Medicare in 1983. It is a supplement to the CPT code book for non-physician services, durable medical equipment, supplies, and drugs. There are 3 levels. Level 1 is regular CPT. Level 2 is National Alphanumeric Codes. Level 3 is locally assigned alphanumeric codes not found in Level 1 or Level 2. ICD-9 International Classification of Diseases, 9th Revision, Clinical Modification, developed by the World Health Organization in 1979. It began as a list of causes of death in 1896. It's 3-digit code followed by a decimal, and there may have an additional 2-digit modifier after the decimal to be more specific. It is international, so if you have a disease in the United States, if you go over to Europe, you will have that same disease. The code should be the same. ICD-10 will be implemented in the year 2013. Why is ICD-9 being replaced? Well, the United States is behind the rest of the world in the use of ICD-10. ICD-9 lacks sufficient specificity and detail to support modern-day medicine. It is getting more difficult to measure medical processes and outcomes to the rest of the world. The mortality and morbidity are no longer universal. The U.S. uses reimbursement and statistical, while the rest of the world uses it for statistical only, due to single-payer and universal healthcare systems throughout the rest of the world. The benefits of transitioning to ICD-10: it is more accurate payment for new procedures. There's fewer miscodes, rejections, and improper reimbursements. It's improved disease management for measuring care, designing. It's a good design for payment systems, for processing claims. It tracks public health. It reduces identification fraud and abuse, and it's good for statistics for research. ICD-9 versus ICD-10. ICD-9 has a 3 to 5 character. ICD-10 has a 3 to 7 character. ICD-9 has the first digit is either numeric or begins with an E or a V. In ICD-10, the first digit is alphabetic. ICD-9 has a 3-digit minimum for disease. ICD-10, all letters are used except for the letter U. In ICD-9, a decimal is placed after the first third character. In ICD-10, the second and third digits are numeric. 4th, 5th, 6th, and 7th digits can be alpha or numeric. And there's a decimal placed after the first 3 characters. The layout of the ICD-9 book, because we are currently still using this, we have Volume 1, 2, and 3. Volume 1, this is the tabular list. It is a numeric list of all codes in ascending order. Volume 2, this is the alphabetic list. It's the index, the first place that you go to find the code. It's located in the front of the book. Volume 3 is the CPT listing used for hospitals. Volumes 1 and 2 are for physician's office reporting. Some books just come with Volume 1 and 2. There are special sections. You have E-codes, external cause of injury. If a patient suffers an injury, the insurance company will want to know how the injury occurred. This section has its own index located after the drug table. So if a patient comes in with a broken leg, the insurance company wants to know, how did they break their leg? Falling down the stairs, falling off a ladder. V codes are supplementary healthcare factors. These are codes for reasons other than illness, disease, or injury. They're for preventative care. These are found in Volume 2. So this would be for going in for a physical. You don't have a disease There's no illness, so we need to put those codes on there, but it's a preventative factor. There still has to be a code. M codes are morphology codes. They're used when there's further identifying behavior of the cell type of a neoplasm. It's used in addition to neoplasm codes for the main classification. There's some code references. We have NEC and NOS. NEC is not elsewhere classified. NOS is not otherwise specified. Used when there is not enough information to find a more specific code. If you see this after a code, this means there's not enough information, then that will be the code that you use. Volume 2, the index. There's a special table to use when coding hypertension. There's also a special section on neoplasms, and if they're classified by the body area, whether they're malignant, benign, or unspecified. There's a section on drug table. It's a list of chemicals, substances, gases, and medications. It's used with E-codes to specifically reference how or why a patient came in contact with a substance. This table is after Volume 2 index and before the E-codes. There are third-party guidelines. Health Insurance Portability and Accountability Act, HIPAA, HIPAA, 1996. Patients' right to expect that health records will be kept confidential. You have to have an authorization of release, and it's only valid for 1 year, so every year when a patient comes in, it has to be updated. We have a signature on file, SOF. This is something that's very important. You want to make sure that your authorization for release is valid every year so that you can put SOF on your claim forms, so you don't have to have a patient sign a claim form every time they come in. Expectations to guidelines for release of information. There are 3 types. The first 2 apply to Medicaid and workers' compensation. The third applies to hospitalizations. The most common claim forms. There is a CMS 1500. This is a universal health claim form. It's an identification information form for the carrier to process claims with an optical character reader. It's used for office visits. The Uniform Bill 04, also known as a CMS 1450, is used for inpatient admissions, outpatient and emergency department services and procedures, home care, hospice, or nursing facilities. Electronic forms. The computer converts data into an OCR format, optical character reader. Do not interchange the letter O with the number 0. When substituting spaces for the following, you want to make sure dollar signs or decimal points in charges or totals, so you make a space instead of putting a dollar sign. Decimal point in a diagnosis code number, a dash in front of a procedure code modifier, parentheses around an area code, and hyphens in the social security number. Express fees in whole dollar with zeros in the cents column. Birth dates should be 2-digit month, 2-digit day, a 4-digit year, not a 2, a 4. When doing your month and your day, make sure if it's a single digit that you have a 0 in front of that. So an example, if you were born on March 3rd, you would have 0303. Common errors in completing a claim form. There's typographical, in the incorrect information, omissions, you forget to put something. The procedure that's linked to the diagnosis is incorrect. The procedure was not medically necessary. All attachments includes the patient's name and policy identification number. Staples must not be used. You must verify that your printer is aligned. Verify that the claim form is signed appropriately. Managing the claims process, a point of service device provides direct access to patients' information through an electronic network. It connects the medical office and the health plan's computer, and they have a card swipe box. Kind of looks like a credit card machine. Maintaining a claim registry or diary. Keep a registry with the following information: patient's name, the date of service, the amount of the claim, the date the claim was submitted, and the date the payment was received. Follow-up. Call the carrier in 4 to 6 weeks if you haven't received a payment. Make sure you use the toll-free number to call the carrier. Have a copy of the claim ready for the information. The payment may have been sent to the patient. In that case, you need to pursue payment from the patient. The claim may need to be resubmitted.